Hello everyone, how are you? I'll wait till the session gets connected to you all. Hi, thank you for joining us here today. We'll wait for some time till this gets connected to more people around. Hi, doctor. So, Dr. Ingles is already here. I will not wait much. I will not waste much time, and I will invite doctor in the session. Well, joining us here today. It's such a pleasure to see you all here. And today we're going
Oh,
to celebrate two
hey
things.
Ritu, how are you?
Hi, doctor. I'm good. I'm good. I'm so happy to see
Oh,
you finally
good,
again
thank
today.
you.
How are
I'll
you?
apologize if I talk funny. I had dental work done this morning, so one side of my face is still numb. So,
Are you
oh
okay?
yeah.
Will you be able to talk? I um I know I'm old now, but I'm so scared to go to dentist. I'm so scared. Today also, if I have to go to dentist, I will literally run away from there and come back. That's how
Yeah.
scared I am.
I had a filling that cracked this morning and had to get it fixed, so it's a, it was pretty
Oh
easy.
God, it
No,
sounds scary already.
it's all good. Oh,
But you're
thank you.
looking good. You're looking good. And today we are celebrating two things. One is, of course, we all know it's for the entire month.
Right.
That's the MS Awareness Month, the month of March. And today is also Women's
That's right.
Day. So happy Women's Day to everyone here, all the ladies joining us here today.
Everyone except me.
So, all the ladies joining here today, happy Women's Day. And on Women's Day, we have Dr. Ingles here, and we start the awareness campaign on our page today with this interview with Dr. Ingles. And that was my request to him that I want to start this campaign of MS Awareness Month with your interview. And we did. So today we are here together and we are going to discuss the main thing that everybody comes back and they have questions even though they're living with a chronic illness for years. Still the question is always there. What about diet and lifestyle when you're dealing with a chronic illness like MS? Well, doctor, before going to more questions, I want to ask you, how are you feeling since you are the one who has actually literally stepped in our shoes and seen what MS is like? Just to introduce, Dr. Ingles is a naturopathic doctor of medicine, and he is an MS warrior himself. So today I'm talking not just to a health expert, but also an MS warrior who understands us and is going through whatever we are
Oh,
going through
well,
today.
I always appreciate talking with you, Ritu, and I'm doing okay. It's funny. We all have our ups and downs, right? And I was actually doing incredibly well, and then I got COVID, and like so many of us, when we get infection, it sets off this activation in our brain. We already have a brain on fire. That's kind of the nature of MS, and so it's not uncommon. I mean, COVID was one of them, but if you get other types of infection, symptoms tend to get worse. And I got COVID twice. The first time wasn't so bad. The second time really hit me hard. It was June of last year. And I mean, I really struggled for many months. The heaviness in my legs, the weakness got a lot worse. The spasticity got worse. So I'm slowly kind of climbing out of
Oh
that
God.
hole, like so many of us. But it's just it's a process, and it's time, it's patience, and it's having faith that knowing that your body has the wisdom to heal. And even when we get these setbacks, it's such a kick in the gut, and it's so frustrating and demoralizing that we put all this hard work in to get our health better, and we get these little setbacks. But I think it's good to go in with the right mindset that that's all it is. It's a bump in the road. And the beauty of being human is that it's built in our DNA to heal. We just got to get these things out of the way to allow that process to happen. And really interesting, I mean, just my own story. So, I got COVID June last year. things got worse. Well, amidst all that, I come to find out that my office was riddled with mold and toxic mold. And I've been working with a toxicologist here in the US. And interestingly, a lot of the molds I was being exposed to are known to cause demyelination. So, you know, you talk about a
Oh,
1-2 punch. And
oh no.
so it was really interesting though, because, you know, I guess the beauty of having your own personal experience is that it's a teaching tool. And it allows me to go back to people I work with dealing with MS and other chronic illnesses. And it's like, oh, well, gosh, if this happens to me, it's probably happening to a lot of other people. And it's interesting, you know, at least here where I live in California, you know, mold is a huge problem. And boy, if you're somebody living with MS or any other kind of chronic illness and you're in mold, you're you're being set up for a lot of problems. So, you know, I think, you know, one of the things maybe we want to talk a little bit later, but, you know, the prevalence of mold and how bad it can be for somebody with MS, I can't even begin to understand. And as I started digging into this deeper and deeper, I was shocked at how many molds out there directly are toxic to the brain and add to that whole demyelinating process. You know, the one thing that's really interesting about MS, if, for people who are listening, if you don't already know, you know, the cells that make myelin, even with MS, are still there.
Mm-hmm.
It's not like these cells go away. It's just that there's more inflammation happening faster than the body can remyelinate. So if we can get the toxicity out, if we can stop that process, you know, there's still that potential to remyelinate. And there are some situations where, you know, if this process has been going on long enough, you can get enough demyelination that the axon, that's that long tail of the nerve, starts to die. And we may not get that back, but you know, our brain is still very neuroplastic. We can create new neural pathways to circumvent that area that's damaged. You know, I always think of it as kind of like people that have a stroke. You know, they might be able to not talk for a while, they can't walk for a while, but they can relearn as the brain makes these new collateral pathways. So, you know, I always think of like Terry Wall's story because it's so amazing, you know, that she was in a wheelchair for 7 years. And I know you've interviewed her, but when you've got someone who's that debilitated, to show that the brain can repair itself, can recover, you know, when the right things are put in place, I think that's always good to know in the back of your mind, because, you know, we're all at different levels of our health. You know, some people function very well. I work with some MS patients that are very physically active. Their MS impacts them very minimally, and I have people in wheelchairs that are very debilitated. But to know that there's the possibility that no matter where you are in your journey, there's that potential to improve your health. You know, I think people need to understand that. And it's, it's hard work. Like I'm a doctor, you know, I know a lot of stuff. And even with that, it's still, you got to put in the work. And, you know, I'm human like everyone else. And sometimes my diet's not as good as it should be. And I'm not moving my body as much as I should be. And I'm busy like everyone else. But, you know, I think this last year has really been a reminder that my health is the #1 priority. I mean, without my health, everything else means very little. So I've, you know, dedicated a lot more time to do the things I need to do to get better and, you know, move my body and work with my own therapist and, you know, physical therapist and everything else, just so that, you know, I can allow my body that opportunity to get well.
Well, thank you, doctor. And I'm so happy that you came to know that you are surrounded by mold and you can take a step towards it. There must be so many people who must be living with mold and must not be even realizing that there is mold in a house. I've studied some of the other studies which some of the doctors say that mold, things like mold can be one of the reasons that you get a
Absolutely.
chronic illness. And imagine a person living with MS or any other chronic illness in a house or office with mold, how deteriorating his situation or health would be with that.
Yeah, you know,
So I can
it's interesting. I mean, I
imagine.
talk with people all over the world. I mean, again, this isn't unique to where I live. This is so many places, and in some places it's so common. Like if you live in certain parts of Europe, and I'm sure India and Asia, I mean, so many places where things are just so old, at some point something leaked. And I've talked to people, it's like, well, there's mold everywhere. I'm like, right, but not all molds are equal. Some molds are worse than others. Some create things called mycotoxins. And again, it's these mycotoxins, which are chemicals that when they get in the air and you breathe them in, they go to the fatty parts of your body, and your brain's a big glob of fat. So the brain and the respiratory system tend to be most affected with mycotoxins. And even if you've got 5, 7 people living in one house, some people might be affected minimally, and other people could be greatly affected. So depending on how well you detoxify and your genetics and everything else kind of dictates how that impacts you. But I think for those of us with MS, we're already susceptible. We're already, primed that when we have that exposure, it just throws gas on the fire and can make things a lot worse. Now, is it the absolute cause for everybody? Of course not. There's numerous causes, but I'm now in the camp that if you've got MS, one of the things you should be doing in addition to your diet and lifestyle and everything else, you got to check your environment for mold and make sure your home is a safe haven. And apartments unfortunately tend to be terribly problematic. A lot of public buildings are problematic, schools, churches. I see so many people that have mold exposure in these areas, and it's expensive to clean it if you've got a problem. I mean, I have a patient out here in California. Their house is 3 years old. I mean, considered basically a brand new house, and they've already spent $100,000 remediating the mold from their house because they've had 3 major leaks. So it doesn't really matter how old your home is. It could be new, it could be old, but it's just something that I think it needs to be on your checklist to rule out, because you can do all this other great work. And again, if you continue to live in a toxic environment, it's going to constantly undermine all this other good work that you're doing.
So what are the things that you need to notice when you have to find that there's a mold in a
Well,
house?
I mean,
What
obviously, if you
signs?
see it or smell it, that's a big red flag. I mean, if you've ever had a water leak and you notice that there's a stain up on the roof and your ceiling, or you see water dripping from underneath the sink in the kitchen or the laundry room, I mean, that's a telltale sign. But more often than not, people that have mold exposure have no idea. They don't see it, they don't smell it, they don't know it's there. It can be in their walls, it can be in your attic, in your basement, it can be in places you just don't see or smell. But that doesn't mean that it's not necessarily there. So the best advice is actually to get a professional to come out. There's different ways they can test it. They can do air sampling. They can do direct sampling if they see mold underneath a sink or on a wall, and they can tell you exactly what the problem is. And then once you know where the problem is, then you can get the proper person to come in and fix it so that hopefully you can get rid of that issue forever.
Oh, that's really difficult and scary. Doctor, since I know that I've been talking to you since years, and I know that you have been very much into diet and lifestyle, at one point you had also tried
Yeah.
other medications, DMTs, like Ocrevus was one of them. But then you said that it's not suiting you. So how has been your journey with different kinds of DMTs that you have used? And do you think that probably this mold also can be one of the reasons that some of the DMTs did not suit you, or
Yeah,
your
the only
situation got
DMT I've
worse?
taken was Ocrevus. I did, the initial dose, and I got all of the side effects and none of the benefit. And interestingly, part of the
Oh,
way that that medication works, it suppresses a very specific kind of cell called CD20, and these are B cells that make antibodies. So it's a way of basically shutting down antibody production. And so my neurologist had said, well, typically you're supposed to get this medication every 6 months, but the new research is showing that you basically need to wait until your CD20 count gets above 1%. And I monitored myself over a year. It took a year and a half actually
oh,
before my CD20 actually got above that. But at that point, my neurologist and I had a discussion. And again, I was doing really well. He's like, at this point, there's probably not going to be a lot of benefit of being on medication. I've had, repeat MRIs. I've got no evidence of active inflammation. So if you don't have active inflammation in the brain, the drugs are probably not going to be as beneficial to you as you might like. I think the general
mhm.
rule that I follow is that if someone is declining and they're getting a lot worse and there's not a good explanation of why, then adding a DMT makes a lot of sense, because again, it may help slow things down while you're trying to figure it out. But since then, I've not been on any other DMTs, so I haven't. I'm still managing with diet. I take lots of supplements. I've been doing hyperbaric oxygen therapy. I've got an eStim device. I get IV therapy, nutritional. So, I mean, I'm fortunate that I have access to a lot of people and a lot of things to do this kind of stuff, but I'm doing my best that way to control it without having to go back to DMTs. And so, I've climbed out of the hole of
Course.
COVID mostly. Again, things are still not quite where they were a year ago, but I can feel, that my legs are getting stronger, the flexibility is getting a little better. So I'm going to do my best to try to avoid going back on DMTs.
I agree. And like you said, that COVID has made it had made it worse for you. I agree. Even I, like you, got COVID twice. And first one, I did not realize much, except it was more of a brain
Yeah.
fog for me and tremendous fatigue. The second one was like really bad for me in terms of physical problems. And it just happened that after getting the second COVID, my completely my smell sensations and my and smell and taste, it got altered completely, and the doctors could not even understand what problem it was, and I suffered with it for around 8 months. And after 8 months I got a relapse, and after relapse, when I had to get my steroids and all done, then my all the problems of the COVID, which I had been having all this while, got resolved. So that's how it affected me. In fact, this relapse which I had was one of the worst I had in the past ever, because the symptoms got worse, and I got new symptoms, and
Yeah.
those symptoms just don't go away. Like, I'm tired, it just comes back immediately. And depression, for
Yeah.
example, got a lot on my head. So I did not know why, but it just happened. And like they say, you don't know what depression is like unless you feel one, and that's where I have been all this while. So it has been a very bad journey for me after the COVID and MS relapse and the journey after that. But yeah, so things are getting better as the days are passing, of course, but it has been really bad. So I agree. COVID and MS together has been like terrifying, not just for me and not just for
Well,
you, but for
we've got a
many
lot of
people
research.
around.
They've been studying, people with MS when they get COVID, again, you get activation of these glial cells. These are immune cells in the brain. And we know that this glial activation goes on for months for a lot of people. So this is a common problem with the MS community that, when we get COVID, it's not like most people who get it for a matter of, maybe a couple weeks to even maybe a couple months. I mean, this is showing, it's going on 6 months, 8 months, a year or longer. So we've got to do a lot to try and control that inflammation post-COVID to try and help mitigate that. But again, it's been such a tough journey for me, for you, it's for so many other people I've worked with. I mean, I've had a lot of people that have had setbacks that haven't been nearly as drastic or as long, but yeah, COVID's been really not nice to people dealing with MS. So again, it's really about, I still think all the other things that we do to get well, I think that's still part of the process of dealing with long COVID. But, I've added in a lot of other, supplements, part of sort of the long COVID protocol, which again, I think has helped. But ultimately, it's about, how do we quiet that inflammation in the brain?
Yeah. So, Doctor, if you
Please,
don't mind,
yeah.
can I just take a few questions from what we're getting? Yeah, we're getting a lot of questions. So, one of the questions which I saw here was about diet. What is the best diet according to
Yeah,
you
so
for
I
these
really
patients?
follow Dr. Wall's diet. I think, the way that she's approached it, it's really eating a mostly plant-based diet, lean meats, getting away all junk food, processed food. We know how critical your gut microbiome is in controlling MS. And, the gut accounts for up to 80% of your immune function. So if you're eating junk food, processed food, fast food, and you're not getting nutrient dense foods, it's really hard for your gut to function well and therefore your brain to function well. I mean, if you think about MS really being leaky brain, if you've also got leaky gut, they kind of go hand in hand. So as we improve your gut function, improve the diversity of your microbiome, that gives your body all the tools it needs to help repair the brain. So, we can take a lot of supplements to try and help improve remyelination, but, we've got to make sure that we start with the gut. You're having healthy elimination, but I really advocate for people, eating, again, a mostly plant-based diet, again, lean animal proteins and getting rid of all the junk stuff.
Right, right. So, doctor, what is your opinion about dairy
Yeah,
products and
well,
soya?
dairy, I should qualify, dairy in the US isn't like dairy in most of the other parts of the world. It's really bad here. So I have all my patients pretty much on gluten-free, dairy-free diet. I've had people who've traveled outside the US that tolerate it better. It's different food. So the dairy and gluten in the
Yeah.
US is horribly adulterated and contaminated, and it's just terribly problematic. So soy, again, the problem with soy in the United States is almost all of it is GMO. So, I mean, if you're in Japan and having
Mm.
whole cultured soy, I think that's one thing. But in most parts of the world, it's genetically modified. And I don't think it's a great food for a lot of people. And I test a lot of my patients for food sensitivities. Soy is just also a very common food sensitivity. So I'm not a huge fan of soy.
Okay. Okay, thank you, doctor. Here I can see a different kind of question by Russell Hughes, and he's written that, doctor, this is not about MS, but I would greatly appreciate if you can respond. Me and my mom developed joint pains and temperature back in November. Doctors diagnosed her with RA, but I still get pains and notice a new cyst in my finger joint, which hurts to touch. What can this be, and do I have RA
Oh,
too?
well, I don't know. I could tell you what it is. I mean, you'd have to see your doctor to get more specific
Hmm.
testing. I mean, there's different types of arthritis, rheumatoid arthritis, osteoarthritis, psoriatic arthritis. Any number of those can cause inflammation in the joints, pain, nodules. So, I mean, the treatment at the end of the day is not dissimilar, though. And it's the same things we talk about with MS. I mean, all autoimmune diseases have this foundational thing of, you know, you got to eat a good diet. You've got to have a clean gut. You've got to get good sleep. You've got to move your body. We know a lot of autoimmune diseases have an association with different infectious agents. We know that certain microbes can be triggers. So for MS, there's an association with Epstein-Barr. With rheumatoid arthritis, there's an association with
Hmm.
Klebsiella, which is a bacteria. So sometimes we are doing stool testing. We're doing other types of testing to see if you've had exposure to some of these organisms. And we've actually been using a therapy in our practice called LDI, or low dose immunotherapy. And this isn't a drug. This is basically like a homeopathic way of dealing with trying to turn off that autoimmune reaction that different microbes can trigger. So for some people, that's been very effective at down regulating that inflammatory response if we think that one of these bugs is part of the underlying trigger. But yeah, I apologize. That's the kind of kind of a vague answer, but there's so many more things that you need to investigate to figure out the source of the problem.
Okay. Doctor, I can see on the question, and her name is Divya. She's written, sir, can you please talk about what medications and supplements
How
do
much
you
time do
take?
we have? I take a lot of stuff. Gosh, I don't know. My camera won't pick it up. I have a big tray behind me. All right, so what do I take? Okay, so my supplement regimen is I take fish oil, I take phosphatidylcholine, I take phosphatidylserine, I take CoQ10, I take acetyl L-carnitine, I take Megaspore Biotic, I take a B complex, I take a ton of magnesium, I take 2,000 milligrams of magnesium, I take nitric oxide, I take, what am I missing here? I take PABA, I take curcumin, I take vitamin D and K2, I take a multivitamin, I take vitamin B12. I was taking glutathione, but I actually stopped because one of the mycotoxins I got exposed to is gliotoxin. And I learned from my toxicologist friends that glutathione actually increases the toxicity of gliotoxin. So if you're taking glutathione, you got to be careful if you've got gliotoxin exposure because it can make that worse. So that's most of my supplements, and I take those 2 or 3 times a day. So I take about, I don't know, 60, 70 pills a day.
Wow.
I have an iron
Oh my
stomach.
God. So that's too much, actually. That's like a
It
whole
is,
meal.
but I feel the difference when I don't take them. And so again, it's not about
Okay.
taking, a ton of supplements, but it can help, again, control inflammation. I take a lot of things again to try and help improve remyelination. So um, they help.
Can I also ask you one thing, that since you're taking a lot of supplements, and actually I also do, inspired by you. So, can this happen that our body gets adapted to some of the supplements a lot, and if we don't have something, our body can crave for those things. Can this also be a
I don't think so. I
possibility?
mean, we're taking nutrients. I mean, we're taking them in higher doses than you would normally get through food. So we're using them therapeutically. But it's not like, if you take them, your body, because your body doesn't really make a lot of these nutrients. We get them from the food we're eating. So in this case, we're just adding them in addition to the food. So again, I still want people getting most of the nutrition through diet. So this isn't like it's replacing what you're doing with your diet. You can't outpace a terrible diet. If you're eating McDonald's every day and you're trying to take a bunch of supplements to counter that, it's not going to work. But again, because I'm taking therapeutic doses of these nutrients, again, with the goal of improving my mitochondrial function, trying to get my myelination to remyelinate, trying to improve my energy, improve my sleep, reduce spasticity, improve my strength. All of these are designed to help, these functions, work better.
Okay. Doctor, can I also know
Yeah,
about
CoQ10.
COQ,
Yeah, well,
the
CoQ10 is a major
supplements?
nutrient for
Yes.
mitochondria, and almost all chronic diseases have some element of mitochondrial dysfunction. So mitochondria are the part of the cell that literally create energy. Without mitochondria, we'd all be dead. So they create energy, but they also help facilitate cell repair. And if you look at the research on almost all chronic illnesses, CoQ10 levels tend to drop. So CoQ10 and acetyl or carnitine, I use acetyl L-carnitine, both of these nutrients are very important for improving mitochondrial function. So whether there's less mitochondria or the mitochondria there don't work as well, these nutrients can help both of that. And so it's one of my things I'm always very diligent about taking because I know that it makes a big difference in my energy.
Yes. So if in fact I have also noticed that whenever I have that, I feel
Yeah.
energetic like within minutes, and yeah. So it also, and if I have it at night, I feel that I am not able to sleep. So I always try to take it during the noon or morning time so that
Yeah.
I'm energetic
Yeah.
throughout the
So yeah,
day.
you definitely want to take these early in the day. Don't
Um,
take them late in the evening because it can mess up with your sleep. So I take mine with breakfast and lunch, and I try not to take them later in the day.
okay, okay, that's nice. Thank you. I can see another question by Vaishnavi, and she's written that diet can help. Which diet can help with nerve pain for
Well,
MS
again, the
patients?
diet's the same. If you're talking about nerve pain, I mean, there are more
Mm.
specific nutrients for neuropathy. So I use a lot of vitamin B12. I use a lot of phosphatidylcholine. I use a lot of phosphatidylserine. I use nitric oxide. I have a lot of my patients locally that I'll do B12 injections. Sometimes the B12 injections work a lot better than just taking oral or sublingual B12. Um, and there's other therapies. I mean, I use things like
Yes.
PEMF, pulsed electromagnetic frequencies. PEMF can help improve nerve pain. Um, Sometimes I use lidocaine patches for people. I mean, it's not a complete fix, but a lot of those nutrients I just mentioned can really help. I try and keep people off gabapentin and these kind of medications because they all come with side effects. But I would try those other nutrients that can
Yes.
really help.
All right. I have a very interesting question here by Steph, and she has written, any opinions on clinical trials for treatment and the risk one
Well, if
is
you're talking
taking?
about drug clinical trials, I'm assuming, yeah, I mean, that's exactly what it is. It's a clinical trial. And if it's a double blind trial, you may not necessarily know if you're getting the active medication or the placebo. So if you're open to trying with the understanding that you are the guinea pig and, no one really knows what the result or the outcome is going to be, I think it's fine. I mean, this is how we learn is, we do clinical trials and we figure out, how the medication works. Does it work for some of the people, most of the people, none of the people? And there's different types of methodologies. Sometimes they do, double-blind studies where you don't know what you're getting. Other times they do what are called crossover studies where they'll give one group the medication, one group the placebo, and then at some point they both switch. And then the other group gets the active medication, the other group gets the placebo. So depending on the study design, it all kind of varies. But, my feeling is if you're open to it, I think if it's one of these things, if I was doing well, I think I would be leery about jumping into a clinical trial. I don't know that I would want to mess with that. But if you haven't been doing well and you've been on DMTs and they don't seem to be doing the trick, I would be very open to being in a clinical trial to see if I get a better result.
Yes, so I've also seen that sometimes in some places it's very unfortunate. Like I was talking to the other girl in Malaysia. She said we do not get DMTs regularly here. It's very so we do not have availability of the DMTs in our country. So what they do is mostly take part in clinical trials so that they get some
Wow.
sort of medications they in some way in their body. That's how they try to treat them. And this girl was also trying to raise a lot of awareness for MS in her country, and that's how I came
Yeah.
across. So yeah, so like you said, if you're doing well, you don't need, but if you do not have anything or you're not in a good condition, then of course you can try. But it's very unfortunate that in some of the countries the medicines are not available. Some people, of course, try to go in the naturopathic way, but it
Well,
doesn't suit
there's a
everyone though.
big study going on at
So
Stanford University here in the US where they're doing bone marrow transplant on MS patients. And, Selma Blair, famous actress, she had this procedure done. And, she was on Dancing with the Stars and functionally, seems to have responded very well to it. But again, it doesn't come without risk. When you do, that kind of procedure, they irradiate your entire body. They kill off your whole immune system. And that has long-term risk as well. And of course, this is all still very new. I mean, I like the idea around stem cells. I think, there's a lot of potential in the future. But, Dr. Walls and I had this conversation more than once. It's like, we don't know what type of stem cells best, what's the best way to give it, how often would people need treatment. Here in the US, it's very expensive. I have people flying all over the world to get stem cell
yes.
therapy, and more often than not, they're disappointed. So again, I think that's something that's coming down the pipe. At some point, we'll learn more about it. Same thing with fecal transplant. I think fecal transplant has tremendous benefit for MS and other autoimmune diseases, knowing that they've done multiple studies that we know the gut of MS patients looks very different than the gut of people who don't have MS. And it may be one of these things that a certain species of bacteria have been killed off for whatever reason. Are we ever going to get those back? And if we can't, well, fecal transplant has the possibility of replenishing those critters that might have been lost earlier. And I have had several patients that, again, in the United States, it's only done under research. So if you really want it done clinically, you have to go to the UK or go outside the US. But I've had people who've done it, and by and large, most people have done quite well with it. Again, it's not cheap, but I like the idea behind it, and it makes a lot of clinical sense, and certainly a lot safer than doing other types of more radical therapies. So I kind of feel like fecal transplant's going to be the wave of autoimmune disease treatment in probably the next decade.
Right. So once if a person has done this kind of transplant, so is a person cured? Is it being said?
Well,
Or
again, I haven't seen any of my own patients who've done it. I know there's a woman in the UK, I've read her story where she had, so again, they take it out of your own bone marrow, they extract your bone marrow, they pull out your own stem cells, they irradiate your body, they kill off your whole immune system, and then they infuse your stem cells back into you. And one woman, one person, it's now been several years after she had it, and she's had no relapse of symptoms at all. And her MRI looks clear. So I
Hmm.
think it has the potential, but I can also imagine that whatever the circumstances were that led to someone's MS in the first place, i.e., like if you lived in a moldy environment, is it possible you could go through all this? And if you still have these same circumstances, is it
Hmm.
possible there could be a relapse somewhere down the line? I don't know. I think there's so many things we don't understand about the development of MS, and I don't think it's one thing. I think it's probably a combination of different things between environmental exposure, toxicity, trauma is huge, and all of that just sort of creates the perfect
Yeah.
storm for this process to happen.
Yes. So I was talking to Dr. E, who specializes in stem cell therapy, and what he said that he had one of the MS patients that he treated. So what happened that her neurologist had said no, but she was really in the state that she could not walk properly and she was in tremendous pain, that she was just ready to spend a lot of money and do the treatment. So she went for it. And what happened after the treatment was her MRI was same. She had around 20, 30 lesions earlier, and it remained the same even after the uh, treatment of stem cells. But her walking ability improved, her fatigue improved, her pain decreased. So what the doctor was saying that it might happen that maybe your lesions do not disappear, but it might give you some comfort in your living style, and that's what we are aiming for. We are not aiming to treat you completely, but make you feel better. If something is not suiting you at
Yeah,
all, we are not saying that everybody should go for it, but if you're done with all the DMTs and the lifestyle way of living, if nothing is helping you, then probably you can try this. This might or might not help. Even they
right.
cannot guarantee on that. But this is a chance which you can take just to have a better life. That's
Yeah,
what,
well,
the
no, it
doctor
makes a lot
told
of sense
me.
because, again, is it possible you could get scarring where those lesions are that don't? I mean, if you get a scar on your skin after you cut yourself, the scar is often there for life. It never completely goes away. But again, that doesn't mean that we can't work around it.
Yeah.
And maybe stem cell therapy, again, helps improve our neuroplasticity, helps make new collateral neurological pathways. So at the end of the day, again, all of us really care about is, keeping our mobility, improving our function, improving our quality of life. And again, if this is a means to an end, great. Unfortunately, at this point, it's super expensive. It's still relatively experimental, and I think for most people, it's just not feasible. But I'm hopeful that, and again, hopefully in the next
Mm.
decade, we'll start to see advances in this kind of research where it becomes more common practice. We learn more about the right stem cell type, the right timing, how much, how often, and have clear protocols that we can follow. Because again, I think that would be a major advance in MS. Because the focus on most MS research is still around drug therapy, and all the drug therapies, even though they work differently, the goal is still the same. It's just to suppress inflammation. And in doing that, they suppress your immune system, which
Mm.
all comes with a litany of side effects. And I forget the percentage. I remember reading a study, the percentage of MS patients that stop their DMTs because of side effects, it's really high. And so it's not uncommon that people cycle through different ones hoping you have less side effects. But again, it's just everyone's different. I just saw a comment scroll by real quickly, and someone says, "I'm doing really well on my DMT." That's great. That's what we want. And so hopefully, you get the benefit. I mean, every neurologist will tell you, the DMTs are not designed to cure MS. They're not going to help with remyelination. They're not. I mean, that's not what the drugs specifically do. If they can control the inflammation to keep you from getting worse, and while you do all this other work, I mean, that's great. I think that's sort of the best case scenario. And then hopefully you're functionally well enough that at that point maybe you don't need to continue your DMT, or maybe you don't need it as frequently as you were doing it before. So it's everyone's response to the medications is different, and every time I see someone with MS, the progression of which medications they've used, it's so different. And of course, every neurologist has their own opinion on which things that you should be on. Is it Tysabri or Copaxone or Ocrevus or, whatever. But it's ultimately, at the end of the day, it's you, it's your body. You've got to decide, if it's right for you. Your neurologist is there to give you their advice. But yeah, I think for people who are doing functionally well, I would be cautious about using the medication, just because, again, it's possible that the medication will be worse than the condition itself, and if it makes you functionally worse, and that's kind of what happened to me. I think I was doing quite well, and my neurologist kind of, I guess, scared me at the time, and uh, talked me into, trying Ocrevus. And in retrospect, I wish I hadn't done it, but, again, another learning experience.
Yeah, I agree. And speaking of side effects, I think I really get what you're saying. It's been like around 10, 11 years that I'm
Yeah.
having Avenix. It's weekly injection, of course. But even after these many years of taking Avenix, I
Yeah.
still have side effects. My weekends that people usually go out to enjoy on weekends, and they have their own life on weekends, and I have to just take the Avenix, and I'm like, okay,
Yeah.
welcome to the side effects. Because I do get fever, and I do get a lot of fatigue and pain or uneasiness. I still get that after years. And in fact, I met my doctor last month, and he said, okay, if you don't want to take Avenix, although it's suiting you really nicely, that's why I don't want to change your DMT, but because you're compromising on a lifestyle you want to change, so let's take the same version of interferon and go
Yeah.
for Plegridy. Now, Plegridy is, of course, 2 times a week, but I saw the dosage. Like, if Avonex talks about of 30 IUs, it is IUs or mg, and Plegridy starts from 60 and 90 and 120. I'm like, from 30 I have to go to 120. So how much side effects will I get from that? When after 10 years, I still cannot get over the side effects from this. But doctor said it will be same, but I don't know. I'm
Yeah.
still scared to try. And I know it's so many people who switch medications because
Yeah,
of
well,
side
sometimes
effects.
it's better to deal with the devil you know than the devil you don't know. And again, sometimes people get,
Yeah,
they get some side effects and they're like, yeah, let's try something else. And then those side effects are so much worse. And then they go back to the other medication and it's not quite the same. So it's really a tough call. And again, my feeling is if you've been on a
very
DMT
much.
and you're doing functionally well, even if you're getting some of the side effects, if they're manageable and livable, I probably wouldn't recommend switching. I think switching is because the side effects are so bad that they're not livable, they're not bearable, or you're still declining, the medication doesn't seem to be slowing things down like you want. Then that would be a good time to talk to your doctor about changing medication, or maybe even if there's a dose adjustment, maybe even adjusting the dose.
Okay. Thank you, doctor. But yes, so it depends. Sometimes maybe if I had a very stressful week, my symptoms would be really bad. I mean, the side effects would be really bad. But if my week has been lighter, a better, a happy week, then maybe my side effects are better. I do not get bad side effects. So it depends from week to week. But the pain of taking the injections every week
Yeah,
is
no,
just too
that's
much.
yeah, I know I'm a wimp when it
So
comes to that stuff too. I hate needles. I wasn't excited about doing any of those anyway. I mean, the funny thing is I originally was recommended to go on Obagio, and then for various number of reasons I never got started on that. And my neurologist now, who I like a lot, he's very open-minded, and again, he even at the time was recommended not to take medication, but he said if you're going to do anything, for me, he recommended Tecfidera. So, that's kind of in the back pocket if things ever got to a point where I felt like it was needed. But despite the setbacks, I feel like I'm still functional enough. I know that it's a bump in the road. And again, I'm doing everything else I can to improve. So as long as I feel like there's continued improvement, then I'll keep on the path I'm on.
all right. Thank you, doctor, for your advice. Thank you so much. So I can see questions by Nikki, and she has written that, can you please help me? I have shaking in my legs, and they go into
Well,
spasm.
shaking the legs, I mean, I'm guessing it's probably related to the MS if that's what you're dealing with. And, your nerves just aren't firing quite the same way. So, again, a lot of the nutrients that we use for neuropathy may potentially help that. Magnesium can be incredibly helpful. Often you find you got to take a lot of magnesium. I mean,
Mhm.
I weigh 230 pounds, about 100 plus kilos, and I take 2,000 milligrams a day of magnesium. So some people need a lot of it, but because magnesium is the one nutrient you burn through the fastest, it's a natural muscle relaxant. It can help with neurological function. And again, phosphatidylcholine, phosphatidylserine, B12, all of these can help improve sort of neurological function. I like Epsom salt baths. You can throw Epsom salt in the bath and kind of soak your legs, and sometimes that helps with some of the shaking and the tremor. So those might be worth trying.
Okay, thank you. And magnesium, I think, of course, it is very good for spasm, and also I think it's very much helpful in fatigue and
Yeah.
even headaches. So when I know that I'm having headache and migraine or something, which is going to come quickly, I know I have to take magnesium, or I'm magnesium
I see the comment,
deficient.
does magnesium make you poop a lot? Yes, if you get too much, you will probably poop more. So if you get too much magnesium, it'll give you loose stool diarrhea. For most of us with MS, that's not the problem. Usually we have the opposite problem, is that we tend to be constipated and have slow trans at times. So you just want to spread the magnesium throughout the day. So take it like breakfast, lunch, dinner. Don't try and take it all at once. So I take mine twice a day. I do like 1,000 twice a day, and it doesn't give me loose stool at all, but it does help keep me regular, and it's fine.
Okay, thank you, doctor. Doctor, can you also recommend something about fatigue? Because I could see a few
Well,
people
again,
writing about fatigue
helping
here.
improve your sleep and your mitochondrial function will greatly help fatigue. So again, B complex, CoQ10,
Hmm.
acetyl-L-carnitine, magnesium, B12, but making sure you're getting good sleep too, because so many of us, we don't sleep well because we're uncomfortable, because of pain, because of spasticity. I have a lot of people taking melatonin as well, even if not to fall asleep, but melatonin is an antioxidant. It's very important for the brain. So even 3 milligrams of melatonin can be helpful in improving your quality of sleep. So all of that can help improve your energy during the day.
Okay. And I will also add to this that when you're fatigued, when one is fatigued, of course, you have to take all these supplements and you have to sleep well. At the same time, you can also try to work out. I understand that maybe your body doesn't allow, you really want to just lie down and do nothing. But trust me, just raising your legs while you're in the bed, or just, playing with the gripper or the sponge ball can also help. And when you get, a little energy, probably you can just have a walk in your room also. That is also fine. But the more you work out, your fatigue level goes down. So when you have fatigue, try and work out as well. It's important. That's what
Yeah,
my
no, it's
experience
really
says.
hard. We all have the days where we just don't feel like moving our bodies, but it actually makes things so much worse when we don't. And I have days where I'm like, ugh.
Yeah.
And it's actually been very cold here in
Yeah.
California, so it's like even going outside, it's like it's cold, it's been rainy, but you just got to do it. And it's like I feel the difference. It's like if I can get out, I mean, 10,000 steps would be great. I don't get 10,000 steps a day, but getting out and
Yes.
just walking, moving around, even if it's slow, it still helps. It moves your blood, it moves your lymph. And I think that's a lot of MS too. It's like if we start getting stagnation of our lymphatics, that's a big way that we detoxify too. Some people get swelling in their legs, they get pain in their lower legs, and a lot of that is
Right.
just that stagnation. So just moving, getting those legs to squeeze a little bit is going to help push that fluid out, and it makes your legs a lot more comfortable. So go slow, take your time. If you're in a wheelchair and you're not ambulatory, work with a physical therapist, someone who can manually, help move your limbs, get that fluid out. But that can make you a lot more comfortable.
Absolutely. Absolutely. And speaking of swelling and all, this thing came to my mind. When I have migraines, my entire one side totally swells up, whether it's the eye or my cheek or down my hand or my leg. Entire thing swells up, entire half of my body just gets into a lot of pain. That's what I do, is like, and it is accompanied by
Yeah.
lots and lots of fatigue. But I try to, of course, because it's migraine, I try to avoid a few things like caffeine and chocolate anyways I don't eat much, citrus, um, and Chinese food. All these things I do avoid at that time because of migraine. And I try to limit my viewing of the screens, the blue screens. And I try to be in dark room. That's what I do. But I try to maintain, if not work out much, but at
Yeah.
least I try to walk. Maybe it's just a minimum of 6 to 10,000 steps, but I try to do that. If I'm not able to do 10,000, but I know I have
Yeah.
to achieve at least 6,000. So it does help in
Yeah.
that
The
as
more you
well.
move, the better.
Absolutely. Speaking of 10,000 step, again, I can see a question here by Fashion Girl. She's written, "Hi, I have MS, but my thyroid is on borderline. And lately, I have been gaining weight too. My eating habits are healthy and I walk about 10,000 steps each day, but see no difference. Can you suggest something?"
Well, if your thyroid's off, you got to get that fixed. I mean, if you're hypothyroid, if your thyroid's underactive, that's your major metabolic hormone. So that can contribute to weight gain and constipation and moods and depression and hair loss and dry skin and all these things. So, hormonally, it's important that you're metabolically on track. So, talk with your endocrinologist about, getting, potentially thyroid medication. I guess depending on where your thyroid lands, that would kind of dictate whether you can just help with nutrients or whether you need medication. But so many people I see, if their thyroid's underactive, I mean, there's a lot of things we can do nutritionally to try and help support it. But some people, honestly, they do better when they on thyroid replacement. It depends too if they have Hashimoto's disease, which is an autoimmune thyroid problem. A lot of people I see with MS, have autoimmune MS and autoimmune thyroid issues. So in those cases, medication works quite well. But you will probably find that a lot of these symptoms get better by just improving your thyroid.
Yeah, so it's just, I think, very common with MS patients that they do develop of thyroid as well. Maybe because of the illness, but also maybe because of some of the DMTs that a person is taking since for long. So I think thyroid is also becoming quite common
Yeah,
nowadays
and I take
amongst the
thyroid
MS
medication as
patients.
well.
Um,
Yeah.
Oh my God, I didn't know that. Okay. Okay, I have a follow-up question here by Fashion Girl only. She's written, "Thanks, but my doctor said my thyroid is on borderline, so no need to take
Well,
medications yet."
it depends on what they're defining as borderline. So, really interestingly, I find most endocrinologists, they really don't seem to understand the thyroid, even though they're supposed to. So, there was a position paper that was written by the American Academy of Clinical Endocrinologists, and they got together with the Europeans and the Australians, and they basically said if your TSH is above 3 and you're symptomatic, you should treat. Yet I
Mhm.
see so many endocrinologists that don't follow that. Your TSH is 4, 5, 6, and a lot of doctors don't check your T3. So free T3 is the best way to understand what your thyroid has available, because that's what the body actually uses. T4 is kind of a hormone in waiting. We don't really use T4. The body converts T4 to T3 when it needs it. So in my practice, we check
Mm.
TSH, free T3, free T4, thyroid antibodies, reverse T3, do a comprehensive thyroid panel. And if someone's even borderline on their TSH, or they have low T3 or borderline low T3, and they're clinically symptomatic, we treat. Most endocrinologists do not. So if
Okay.
you've got a doctor who says you're borderline, but you're having symptoms and they're not willing to treat you, I'd say go find a doctor who will. Yeah.
That's a very good advice, actually. Doctor, I have another question about sleep management. Ashu has written how to manage breathing issues and sleep
Well, if you've
apnea
got
in
sleep
MS.
apnea, I mean, I would say work with the sleep specialist. There's a lot of different treatments, anything from a CPAP device, the little thing you put over your nose or mouth and you sleep at night to make sure your airway stays open. They've got dental devices now that, again, keep your jaw from sliding backwards. It's a good idea to see an ear, nose, and throat doctor. Make sure you don't have physical obstruction. If you've got swollen tonsils in the back, like your adenoids, that can obstruct your airflow. So the treatment kind of depends on why you have sleep apnea. So you have to kind of establish the reason first,
Mhm.
and that's usually done through a sleep study. But it's not, weight is also part of it. If your weight is higher than it should be, that disposes you to sleep apnea. So losing weight will also help make a difference. There's not really a pill to improve sleep apnea because, again, it's a usually obstructive apnea, and that's where you need something physical that's going to help open up that airway.
Okay, okay. Doctor, before we proceed, I just want to ask you, we've been talking for 1 hour
Yeah.
now. I know the time flies. Is it
I've
okay if we
got another
continue,
meeting in
or
about
we
three
can just
minutes,
take
so
that?
I can take probably one more question.
Okay. Okay, just see. Let's see the last question that we have received here. Um, okay, just one question. So from so no. Okay, so diet questions doctors already asked. So I need to ask. Okay, one question that we have received is my neck feels really stiff. I don't know if it's MS related or not right now. I have been working out a lot recently and been down with a sickness bug. Could you could this be the reason?
Well, any kind of stiff joint, I mean, you can get stiff joints just with MS because if you're dealing with spasticity, every time that muscle pulls in and around a joint, it can push on the joint. So a lot of MS patients get joint pain, not because they've got arthritis per se, but because it's the muscles pulling. But if you've been working out more, you could start getting a little bit
Hmm.
of pain just from exercising more. I mean, I would assume if it was from working out, the pain would fall on the heels of having just worked out. I mean, you can get joint pain with when you're sick too. I mean, certain viruses, other bacteria can cause joint pain. But again, I would expect that that would happen shortly after you got sick. So if it's not correlated with the onset of illness or not correlated with the onset of working out, then it could be just related to, how the muscles are interacting with your joints. And anything we can do to kind of help improve muscle spasticity tends to help the joint pain. Yeah.
All right. Okay. Thank you so much for all your help, doctor. It's
Uh,
been such a pleasure
uh,
speaking to you once again. Thank you for answering so many questions here of
Great. All right.
everyone
Thank you,
that have
Ritu.
been coming in. It's always a
Okay.
pleasure speaking to you.
Bye-bye.
Thank you so much. Have a good day. Bye, doctor. Thank you, everyone. Thank you for joining us today. Yes, this session will be saved on Instagram, and you can, of course, go back and see what all has been answered. We have spoken a lot about moles and the vitamins, the supplements, the diet, the lifestyle, muscle spasms, sleep apnea, and many other things. So you can always go back. And I know there have been a lot of questions which have been unanswered too, but we'll be doing more such sessions with Dr. Ingles again and some of the other health experts too. So stay tuned, and we'll be telling you about the other upcoming sessions with the more health experts. And also, don't forget to follow Dr. Ingles as well. He's one of the kindest and the most amazing naturopathic doctors that I have come across. And he is just full of knowledge, and he is also an MS warrior. So stay tuned for more such updates. Muscle spasm, yes, please, I will go. Yes, please go back and see all the questions that have been answered in this session already. Thank you so much, everyone. Have a good day.